How does bladder anatomy affect your bladder health? Imagine your bladder as a flexible balloon inside your pelvis, designed to hold urine safely until you're ready to go. Its structure and how it's built play a big role in keeping your urinary system healthy. The main part of the bladder wall is made of a muscle called the detrusor muscle. This muscle is like a stretchy, smooth layer that allows the bladder to expand as it fills and then contract to push urine out when you urinate. If this muscle doesn't work properly, it can cause problems like difficulty emptying the bladder or involuntary leaks, which can lead to infections or bladder damage over time. The lining of the bladder is made of special cells called transitional epithelium, which are designed to stretch without tearing and act as a barrier to protect underlying tissues from urine irritation and bacteria. The capacity of your bladder is also important. On average, it can hold about 400 to 600 milliliters of urine, but it can stretch to hold up to 800 or even 1,000 milliliters if needed. This elasticity comes from folds in the lining called rugae and the flexibility of the detrusor muscle. If the bladder loses its elasticity or capacity, you might find yourself needing to urinate more often or feeling like you haven't fully emptied your bladder. That can cause irritation, increase the risk of bladder stones, or lead to infections. Another key feature is the trigone, a smooth triangular area on the floor of the bladder. It's formed by the openings of the two ureters, which carry urine from the kidneys, and the urethra, the tube that leads out of the body. The trigone helps keep the shape of the bladder consistent and ensures urine flows smoothly out. Tiny mucosal flaps act like valves at the ureter openings to prevent urine from flowing backward into the kidneys, which is crucial because reflux can cause infections or damage to the kidneys. Controlling when you urinate involves two muscles called sphincters. The internal urethral sphincter is involuntary and helps hold urine in, while the external urethral sphincter is voluntary, allowing you to decide when to release urine. Proper coordination between these sphincters and the detrusor muscle is essential for maintaining continence. If these muscles or their nerves don't work right, it can cause incontinence or retention, affecting your bladder health. Your nervous system also plays a vital role. It sends signals to your bladder to tell it when to store urine and when to empty. Damage or diseases affecting these nerves can cause symptoms like urgency, frequent urination, or difficulty emptying the bladder. These issues can lead to infections, stones, or other complications if not managed properly. The position of the bladder in the pelvis varies between men and women, which can influence how other health issues affect it. For example, in women, the bladder sits in front of the uterus and vagina. Conditions or surgeries involving these organs can impact bladder function, sometimes causing irritation or changes in how the bladder works. When it comes to bladder stones and bladder cancer, anatomy is especially important. If the bladder doesn't empty fully or if urine stays in the bladder too long, stones can form. Problems with the detrusor muscle or outlet obstructions can cause urine to stagnate, creating a perfect environment for stones to develop. The lining of the bladder, made of transitional epithelium, is also where most bladder cancers start. Chronic irritation from stones, infections, or other conditions can damage this lining and increase the risk of cancer over time. Understanding your bladder's anatomy helps in recognizing why certain conditions develop and how they can be treated. Maintaining healthy bladder function involves keeping these structures and their coordination in good shape. If you experience symptoms like frequent urination, urgency, pain, or difficulty emptying your bladder, it's important to see a healthcare professional. They can evaluate your bladder's structure and function, diagnose any issues, and recommend appropriate treatment to keep your bladder healthy. Remember, every person's anatomy is unique, so personalized medical advice is always the best way to address bladder health concerns.